Nurses across the country have this afternoon confirmed they will walk off the job for 24 hours on July 5th. The strike follows the rejection of a deal from the DHBs, which included pay rises of 9% over the next 15 months for some nurses, some eligible for a 15% pay increase. That's at the upper end of the pay scale. DHB spokesperson Helen Mason joins us now live. Helen, are you there?
I am. Hello, John.
Hi, lovely to have you with us on Checkpoint. Thank you for joining us. What's your take on this news?
That we absolutely, nurses, midwives and healthcare assistants, John, are really highly valued members of DHB teams. We completely respect their right to industrial action. At the same time, our priority is keeping patients safe. And so DHBs are working very, very hard to ensure that we've got really robust contingency plans in place should the strike go ahead. Having said that, John, I remain optimistic that we're going to find a settlement before there is strike action. We're working very closely with NZNO. DHBs are really committed to doing everything that we possibly can to reach settlement on this agreement to avoid disruption to health services.
Right. How can you do that, given the government has said there is not a dollar more in the kitty? What is it that you believe, in good faith, you can offer that will make a difference?
But, John, I think that in terms of what this means for nurses, midwives and healthcare assistants pay packages, I think it's an excellent offer. And I think that that's part of the equation. I think that there are many things actually outside of what people take home in their pay that are of concern to our nurses. And that's about working conditions. And we've heard nurses' frustrations and their concerns around this, and DHBs have responded to it. So the reason that I'm optimistic is I think that there are things outside of pay and outside of the dollars that are on the table at the moment, which is $500 million, and that we can work on. I think that what we need to do is that we need to give nurses trust and confidence that DHBs have heard them and that DHBs are going to be taking action to improve working conditions for nurses. So
okay, let's talk about how you can do that. How can you meaningfully and materially improve working conditions to such an extent that the nurses call the strike off?
So I think that what nurses need is confidence that DHB is going to be taking action over the short term. Part of the offer, John, is the additional $48 million, which is for an additional 500 nurses. So what I'm hearing nurses talking about is their concerns about, when things get busy, is there a colleague to call in? Is there an additional nurse to bring in when things are really busy? So that $48 million is about bringing in an additional 500 nurses, and I think that will be a substantial help. I think it's also about DHB's commitment to the full implementation of the Safe Staffing Program and care capacity demand management. There's another $10 million to make sure that all DHBs have got resource to get to full implementation. And the other thing as well, John, that's kind of outside of the pay package is DHB's commitment to work with nurses on pay equity.
Okay,
I think there are a lot of things that we can work on that are outside the dollar value, and really I want nurses to know that we have heard their concerns and their frustrations, and we're deeply committed to improving their work conditions.
Absolutely, and that's a point you've repeated a couple of times, and I'm sure any nurses listening will have heard that. But if you can't persuade them that that is meaningful and material, if you can't make that flesh and concrete, if you like, what are you going to do to cover for potentially 27,000 striking nurses?
DHBs are working really hard on contingency plans. And, John, we're actually working very closely with NZNO and together on the contingency plans. I'd like to reassure our communities that DHBs have been, and, we always hope for the best, but we have to plan for the worst. So we've been working on contingency plans for months now. And now that we have strike notice, we're absolutely ramping up those efforts to ensure that patients and staff, because it's equally important to keep staff as well as patients safe during the strike. There's really significant work going into that at the moment. It will mean that we will need to defer and reschedule services, and so there will be significant disruption to services. But what I'd like to do is I'd like to reassure communities that there will be ongoing access to emergency and essential services. For anybody who is directly impacted by this in terms of having any kind of surgery, for example, rescheduled, for any affected patient, DHBs will be making contact with patients who might be affected. I'd like to get a message out to our communities that if anybody's got an urgent medical need, please do not hesitate to front up to hospital, and to reassure people that might have medical needs, and to remember that they can access GP services and that they can also talk to their local pharmacists, who are incredibly helpful. Dial 111 if it is an emergency, and we've also got the health line and the free 0800 number available for people to access. So we're working very, very hard to ensure that if industrial action does go ahead, that there will still be safe access to emergency and essential services.
Helen Mason, who's the DHB spokesperson, joining us live. Thank you very much indeed for your time.